The Affordable Care Act is an important step in expanding health care to everyone, and it has already helped millions of people. Nonetheless, Republicans across the country and Republican members of Congress, like Representative Fitzpatrick, and governors like Tom Corbett, are vowing to kill this law. And starting today, the U.S. Supreme Court will hear arguments about the law's constitutionality that have been brought forth by a Republican lawsuit from across the country. This new health care law prohibits insurance companies from dropping you if you get sick, discriminating against you because of pre-existing conditions, and now preventative care, such as child visits, mammograms, and cancer screenings, have to be covered with no deductible or copay. Repealing this law will hurt millions of people's ability to access quality health care. Yet that is what numerous members of Congress, including Mike Fitzpatrick, are saying they want to do. Repealing this law will cost the state millions of dollars in additional health care costs. Yet that is exactly what Governor Corbett wants to do. Today, we have members of this community here to tell us their stories about how their lives have improved because of this historic legislation.
After being without insurance health care services from June of 2007 until October 2010, and being in my 60s, finally having health care coverage was a feeling of joy and relief. My premiums are $283.20 a month, and it carries a $1,000 yearly deductible. I wasted no time in making my appointments for GYN checkups, mammogram, bone density tests prescribed by my doctor. My checkup had no copay, nor did the mammogram. The bone density test was 20%, or $220. So if you figure that out, if I didn't have insurance, it'd be $1,100. The bottom line is this: like millions of other Americans in America, I went with health care due to a pre-existing condition. Thanks to the Affordable Care Act, I am able to rest at night. Thank you.
The pre-existing condition she has was a little thing of skin cancer that was removed, but everybody we've talked to about getting other health care either turns her down or quotes premiums of $800 a month. So it's really, right now, we're in between a rock and a hard place. In 2014, she'll be protected by this new law and won't be able to be discriminated against.
This year, the good news is all the preventive care was free. I had no co-pays. It was great. And I've told many people who were not even going for preventive care, but now I know some of them will go. I come out because I want to preserve Medicare for the future generations.
Hi, my name is Linda Mintz, and I'm a retired school nurse. I live in Bensalem, and I'm 64 years old. So I'm really looking forward to being covered. I'm due to get all my screenings like right now, but I'm waiting till October. I won't have to pay any co-pays. I'm going to get the bone scan, the mammogram, colonoscopy I should have gotten last year, but I waited. Why not? I'll wait another year, and there's no coverage. I also have a bad knee that needs an MRI. I had that 6 years ago. That MRI was $1,000. You're paying several $100s for these screenings, and people don't get them. They tend to put them off sometimes because of the costs. So with this being covered with the Affordable Care Act, that little help with Medicare, and since I'm a nurse, I can see that this is going to result in tremendous savings right away and many, many years forward if people are going to catch their diseases early and get treated for it. It's just common sense.
The attacks at the federal level are real. The attacks at the state level are real. We often don't hear about what's going on in Harrisburg in terms of the Affordable Care Act. 2 weeks ago, Senator Scarnati introduced legislation that would amend the Pennsylvania Constitution and say that any law that requires individuals to purchase health insurance would be illegal. Our governor is one of a handful of governors that brought the lawsuit to the Supreme Court to repeal the Affordable Care Act. Instead of having dialogue on how to move forward and how to make sure that seniors access their preventative care and how people don't end up in emergency rooms, we're having a dialogue about how to take that away. So we need to be contacting our legislators and sharing our stories. Republicans in Harrisburg and Congressman Fitzpatrick want Barb to have to go back to the emergency room. They want you to have to pay $400 to get a colonoscopy. That can't happen. So the time to act is now. So go to your legislators and tell them, we don't want you to take preventative care away from 2 million seniors in Pennsylvania. We don't want 65,000 young adults in Pennsylvania to go without insurance. This is going to continue over the next several weeks, so make sure that you talk to your legislators in Harrisburg and at the federal level and say this is unacceptable. Thank you.
Thank you.